increasing availability of vaccines and reasonably quantity in the pipeline, we are declaring December as the month for vaccination, or let's say vaccination for Christmas. So December is going to be declared as the month of vaccination, and to be launched by the Honorable Minister on 30th of November 2021. That's Tuesday coming. This mandate, which I'm going to announce, will be applicable in January 2023 at specific groups and manners as soon as, and this mandate become effective as soon as the campaign is over. We have them in two sections. They are going to have proposed groups that will be covered under the mandate and the venues. We are looking at all the three arms of government. All health workers have been given the opportunity to vaccinate, and they stay in a very strategic position that either they can share among themselves or give to their patients. So that's why we prioritize that. And remember, we are talking about these are the people who have been prioritized at the beginning, even when we had very few vaccines. And so we expect that. All security personnel will be covered. They should be vaccinated. All staff and students in secondary and tertiary schools should be vaccinated. And so secondary schools are being given the opportunity. Started last week, Friday, from 27th, almost all regions are doing vaccination of Pfizer in schools. And so in January, you should be fully vaccinated before you come back to school. All workers in government institutions and parastatals, all commercial drivers and their mates are expected to be vaccinated at the end of that. That's where they're commanded to cover them. There are areas where the mandate to cover, that will be a venue. And this venue for now includes nightclubs, beaches, sports stadium, and restaurants for indoor dining. And these are areas that will mean that you need to be vaccinated before you can go into these venues, and that will be enforced. So these are the mandates in terms of the group that will be affected and the locations which you have identified are areas that you have to be vaccinated to be able to participate in any event occurring in those places. So what's our outlook? We have increasing access to vaccines, COVID-19 vaccines. We have some level of people who are still unsure. I don't use the verses, they are unsure. Because what we have noticed is that they may not come, but if the vaccines are taken to them, they take it. So I'll say they don't feel the urgency to go and have the vaccine. But you see, the best time to vaccinate is when you are not sick. I'm just coming from a funeral of my sister. When he got COVID, that's when you're looking for vaccines. Okay? So the best time is to be doing now, not when you have. So the COVID has affected all of us. It's not just for. The current low numbers recorded may not be maintained if vaccine uptake is not increased. So the vaccines are available. It's all of us' responsibility to take it up. We may have, there's possibly fear of a surge after Christmas. But of course, the Christmas, it's after the parties and this thing that it starts. So it will not be a Christmas. You may enjoy your Christmas, but after Christmas, that is when. So we need to be very careful. We are going to take care of our risk communication. We are doubling our vaccination teams. We are moving around more now, and so we are looking for support from all government institutions in the locality to assist these people do the vaccination across.